How do you feel about Utah's current trajectory with COVID-19? Are we out of the woods yet, or is this just another dip in the wave?
We're not out of the woods, but I do like the trajectory.
With things looking better, are you looking to make any changes to the color-coded scale? Salt Lake City is still in orange, other parts of the state are in yellow, some places are green.
I have no intentions of making any changes as of right now. Again, some of that may come from a request from the local jurisdiction for us to take a look. But as of right now, I don't see that happening. We have a lot on our plate right now with school opening, and that's going to be a challenge to how we handle that statewide too. So I think we're in a good place right now, and we'll just let things percolate for a little bit.
Will you be extending the state of emergency past August 20th and along with that the health guidelines?
That'll be a decision made probably by the legislature. I have a limited period of time that I can declare a state of emergency. It has to be reauthorized by the legislature. They've done that and extended it to August 20th. And so we'll wait and see what happens.
But will you be asking them to?
I don't know that we need to continue it on. I think we need to make sure that we have the ability to, in fact, put it in protocols that are appropriate, which we really have in place now.
If you could rewind the clock to before Memorial Day, would you do anything different?
If I could, probably would do things different because we've known more since Memorial Day, but we didn't know then more. And so we acted upon the best information we had. As you recall, the CDC came out and said masks were not helpful. There's a lot of theories on why they said that. Some was the shortage of masks, and they wanted to make sure that those in the hospitals had access first and didn't run out with a run on masks. They've since have come back and said masks are very important. We've seen the study out of BYU that says that they're essential. So again, we've learned a lot since the beginning, and if we knew that back then, we probably would have had more emphasis on masks.
So at this point then, why not issue a mask mandate? A lot of other states have been doing it.
Some have with success, some have had challenges. Again, it's a matter of how do you change people's behavior? Do you mandate that you do it? That's the kind of the stick approach. Or do you have the carrot approach? And say, you know, it's the right thing to do, showing respect for your neighbors. We've been able to do it so far with powers of persuasion.
So what more do you plan to do to help us get out of this?
Well, that's why our Unified Command meets every day. We look at the data, we look at the statistics, we see what is the policy that's working, what do we need to modify, change, nuance. What are we doing to help encourage people to do the right thing, help retail businesses. You know, we have some concerns with gathering at some of our bars. We've had some photographs of people gathering and not having the social distancing that was required, and violating really the ordinance here in Salt Lake City and Salt Lake County. So we will monitor that stuff every day and see what we need to do do something better. All the time trying to make sure we have hospital capacity, we don't overwhelm the healthcare system, looking towards that day when we have a vaccine. I was on the phone just yesterday with the Vice President. They're hopeful a vaccine will emerge by the end of this year. I've talked with our healthcare experts here in the state of Utah, Intermountain Healthcare, the University of Utah, et cetera, and they believe at least by the end of the first quarter of 2021 that we should have a vaccine available. So sometime in that time frame, we should have a vaccine. That's the one thing that we're trying to tread water to get to, which will help us get back to normalcy.
Governor, you've talked a lot about lives and livelihoods, trying to balance these two. I do want to ask, is there a fast track to reopening the economy?
I don't know that there's a fast track. I think we need to be methodical and careful. We've done, I think, a good job of balancing the approach. We have not closed down the economy like many other states have done. We've made some restrictions. We certainly have asked people to stay home and stay safe and limited travel. We certainly had the school that we closed down towards the end of the year. We restricted some activities out there. But not as much as most every other state. In fact, we've been listed as the 4th least restricted state in America. So we start from that position. Then the question is, how do you, in fact, open things up and encourage activities to take place? People shop or don't shop based on how they feel when they go to the store. If they feel like they're going to a high-risk environment, they probably won't go. And hence, we've had a lot more home delivery, curbside shopping, takeouts from our restaurants, those things. Technology has allowed us to do things that we haven't done in the past, and it will probably continue to help us along the way to getting back to normal. If you take the two main factors, and I hate to bring it up, mortality, but our mortality rate is the lowest in the nation. It's at 0.8, less than 1%, where the national average is about 3.2%. So, you know, it's significantly lower than the national average. We're doing better when we keep people alive in Utah. And secondly, our unemployment rate is at 5.1%, the second lowest in the nation. So that means our economy is improving.
But medical experts have certainly pushed back on the idea of reopening things too quickly, leading to surges in cases. Have you listened more to business interests than you've listened to scientists?
I think we've tried to find the right balance. That's the whole point. And what is the right balance point? It can't be all shut down the economy, which has its own set of consequences. Mentally, we have depression, we have domestic violence. There's all kinds of issues that come with people being out of work and the economy going into free fall, as opposed to just we want to be concerned about people's health too.
We are now in the process of reopening schools, bringing kids back to school. Given what we've seen in other states right now, is this a smart move in your mind?
Well, again, there's a downside to not having school, and we ought to look at what are the options, you know. Now, how we do that and when we do it probably is the discussion, and we've left that to have our health department give standards. This is what we expect as far as a standard minimum when you go back to school and you have education, whether that be social distancing, the wearing of a face mask, washing of hands and hygiene, regular basis. There's standards out there that must be followed by all the school districts. But how you implement that is a local school district decision, working with the superintendents. Again, the local school board elected by the people in their neighborhoods there that represent the people. And we're finding out of our 41 different school districts, there are probably going to be 41 different approaches to how that's going to happen. Some are going to open up earlier and others will open up later. Some will open up with in-class instruction. Some will be online. Some will have homeschooling. The intent, I think, is to make sure that parents have choice, where they can say, well, for my family, this choice works best. For my family, this other choice may work best. We want to protect the students, make sure they have a safe environment to go to when they go to school in-house. We also want to make sure that the teachers feel safe when they go to that environment and teach our students too. So it's really a mutual challenge to find safety and well-being inside the schools for teachers and students and any and all who are associated with the education system.
But do you believe that we've been able to safely guarantee that that can happen, or is this a prelude to another surge?
What I think we're doing is managing the risk. There's no way to eliminate entirely the risk factor for anything in life, and particularly during a pandemic. So if anybody's looking for, we want zero risk when we open up our schools, that isn't going to happen. But we can minimize the risk and maximize the opportunity.
As you look forward, though, what do you see in the next 3 to 6 months until we get that potential vaccine in 2021?
I think we'll continue to have good communication with the individual school districts and the local health departments. They need to be in constant communication to understand the data, and we'll see what the trends are and see what the data shows us as far as case rates, infection, transmission rates, which is a key issue for me. That's if you have it, how many other people will you infect? As of today, we're down to one person infects 0.9 of another. That means we're starting on the decline. That's a good statistic to have. We'll try to monitor that. It's hard to predict, by the way, but we're going to monitor that closely. And if that continues on, again, the protocol we have in place is working. If in fact we have a surge or a spike, then we may have to make some adjustments on our protocol. That's why I say, you know, the mandating of a mask is still part of the toolbox tool available if in fact we end up having something that untoward would happen and have a surge and people discard wearing masks voluntarily. We may have to make it a mandate.